Dear Miami Lighthouse Heiken's Children's Vision Program, I am so glad you gave me these glasses.
I can see better now.
Now I can copy from the board without making any mistakes.
I can see very clearly with the glasses.
Thank you.
In 1992, the trustees of the Dade County Optometric Association were concerned that thousands of children were being screened for vision problems in the Miami-Dade County Public Schools, and many of them lacked insurance or financial means to be able to pay for eye exams and eyeglasses. So we identified children with vision deficits that could affect their learning, and yet we had no means of being able to make sure that they got the eye exams and glasses necessary so they could have their best possible vision.
We had a vision screening that we hold once a year here that our school nurse conducted, and she identified 40 students who needed eye care.
Well, I couldn't really see the board in math class, and I could never really figure out why my grades were so horrible. I was a C and B student. But then one day they pulled me out of class because a bunch of optometrists came to the school and they set up a shop in one of the empty classrooms.
When our students fail the screenings, our screeners work in collaboration with the other school-based student services personnel and our Health Connect and our schools teams, and they identify the students. They take care of securing parent permission forms, and an actual mobile unit comes out to the school site and tests our students immediately with the follow-up vision examinations that are required based on those failed screenings.
Through our verification process, determine if they have Medicaid or any other insurance, and if they don't, then we provide them with an eye exam and eyeglasses if necessary. We actually have two ways of doing this. We can either go to the school if there's a large group of students that need to be examined and provide the exams on site on one of our mobile units, or we can provide the exams at a private doctor's office who is on our panel of providers. For those who need specialized medical care, we also have some ophthalmologists that provide care as well for those students who need medical intervention for their vision.
On an annual basis, probably more than 13,000 of our students fail those mandatory vision screenings, and approximately 8,000 of those families would not have an alternative to provide the follow-up examinations that their child needs in order to be able to see well and ultimately in order to be able to learn.
The main goal of the Miami-Dade County Public Schools is to educate students, and we have thousands of students every year that are identified as having vision deficits. Vision is very important to learning. If a child cannot see the board, if they cannot read efficiently and comfortably, their capacity for learning is greatly diminished.
And with the Heiken Fund, we have been able to target and identify students that really struggle, and we have seen them blossom into amazing students, turning around from students who were low performers at one time to now students who are on honor roll and are just so proud of themselves.
Another aspect of having good vision for students is that the parents are very pleased and happy that their children are able to learn better. And of course that translates into better grades and of course a better future.
The Heiken program has really changed my life in that it told me that my eyes are so bad in terms of sight that I really need glasses to become who I want to be and to reach my full potential. Now I'm graduating from Coral Reef Senior High School as a 12th grader. I'm going to go to UF next summer, and then I have a 5.18 GPA.
In order to provide the necessary eyeglasses to the children who are our clients, we have to partner with a laboratory. And we have recently partnered with OptiLab, which is a Greater Miami laboratory that provides us with our eyeglasses. The service is very quick. We get turnaround in approximately a week or less, and we have excellent quality frames to provide these children with glasses that they will feel comfortable wearing.
We have opticians on our staff who go out to the schools and fit the students with the glasses to make sure that they fit correctly and fit comfortably, and then also educate them on how to take care of them.
There is no other program within the state of Florida that has the capacity of having 3 complete mobile eye care units available to go out to the schools and perform eye exams on site for our indigent children. And we're all so proud to see how this program has grown, and we are so close to accomplishing our initial goal, which is to provide every needy child in Greater Miami who attends our public schools with the opportunity to have a free comprehensive eye exam and eyeglasses if they are not able to afford to pay for it and if they lack the insurance to pay for it.
If it wasn't for the collaboration with the Miami Lighthouse for the Blind Heiken Childrens Vision Program, we probably would have 8,000 to 10,000 students annually who would not receive the follow-up services, the diagnosis, and the specific securement of glasses in order to help them see and to learn.
Dear Miami Lighthouse, I want to thank you, and I really appreciate the glasses.
I'm doing really good in school now because I can see what my teacher writes on the board.
I just wish I could repay you.
Thank you for using your time to come to my school and work with me. I couldn't thank you enough.
Thank you, Miami Lighthouse!